Have you ever been told something is just impossible? You know, in dentistry, that word got used a lot for patients who had severe bone loss in their upper jaw. But what if? What if you could just bypass the problem entirely? Well, we're going to dive into a pretty amazing dental solution that's changing lives, and it does it by borrowing a principle from a place you'd never expect: bridge engineering.
All right, so before we get to the really cool solution, we have to appreciate just how massive the problem is. We are talking about one of the toughest nuts to crack in all of dental rehabilitation.
I mean, seriously, just imagine hearing those words from your dentist. For so many people, it meant their only options were removable dentures or facing these incredibly complex, painful surgeries. That was the reality for anyone dealing with a very specific and really challenging condition.
See, the upper back part of the jaw is like a perfect storm of problems. The bone there is often naturally soft and kind of porous to begin with, and sitting right on top of it, the maxillary sinus. So after you lose teeth and time goes by, that bone just vanishes. It literally melts away, leaving absolutely nothing for a standard implant to hold on to.
Now, the fancy clinical term for this is an atrophic maxilla. But really, all that means is the jawbone has shrunk so much that it's just not a stable foundation for teeth anymore. And this isn't some rare thing. It's a huge challenge that dentists have been grappling with for a long, long time. So how did they try to fix this before this new revolution came along? Well, the old school approach was basically to rebuild everything that was lost, and that meant some pretty invasive stuff.
The traditional thinking was pretty straightforward. Hey, there's no bone, so let's add more bone. This led to procedures like sinus lifts, where they literally push the floor of your sinus up to make room for bone grafting material. Or they'd have to take chunks of bone from other parts of your body, like your hip.
But here's the thing. Those methods come with a long list of drawbacks. They take forever, there's always a risk the new bone graft won't heal properly, and it means you have a second surgical site, the donor spot, which has its own pain and recovery. Honestly, for a lot of patients, especially older ones, the idea of going through all that, sometimes multiple times, was just a total non-starter.
And when you put the timeline side by side, it's just staggering. We're not talking about a little improvement here. This is a whole new ballgame. We're going from a process that could easily drag on for more than a year to getting permanent, fixed teeth in as little as 3 weeks.
So what was the big idea? What changed everything? Well, the innovation wasn't about trying to rebuild that weak foundation. It was about finding a completely different, much stronger anchor point that was actually there the whole time.
And here it is, the Pterygoid Implant. The core idea is so simple it's genius. Why bother trying to fix the weak, shrunken jawbone when you can just go around it? These are long, specially designed implants that are angled way back to reach an area of incredibly dense, stable bone that pretty much never shrinks away.
The key here is the destination. The implant travels through the soft bone at the very back of the jaw, that's the tuberosity, and it locks firmly into a part of the skull base called the pterygoid process. This gives it an unbelievably strong anchor in that hard outer layer of bone, what we call cortical anchorage. Okay, now this is cool. Check out this 3D render, because it really shows you the cleverness of the whole thing. Just look at that angle. The surgeon aims it back at about 45 degrees, completely dodging the sinus cavity and zeroing in on that super strong bone deep inside the skull. It's a precise move that requires a serious understanding of anatomy.
And the stability here isn't just from one point of contact. It's what you could call a trifecta of support. The implant engages the maxillary tuberosity, then the pyramidal process of the palatine bone, and finally, it locks into the pterygoid process. It's like driving a stake through 3 solid layers, creating a foundation that is just unshakable.
Now, you know, an idea this revolutionary doesn't just appear out of thin air. It's actually been evolving for decades. The concept was first proposed way back in 1975, and the surgical technique was detailed in 92. But it's today's technology, with incredible 3D scanning and perfectly engineered implants, that has really turned this concept into a highly predictable and super successful reality. All right, and this is where it gets really cool. A single one of these implants is incredibly strong, yeah? But when you combine several of them together, you can create a structure that's based on a timeless engineering principle. It's called the Bone Truss Bridge, and it's an approach that takes the stability of each of these individual anchors and basically multiplies it across the entire arch of your jaw. And here it is. This is the big aha moment. On one side, you see an architectural truss bridge. See how all those triangles spread out the weight and make it incredibly strong? Well, on the other side, you see the exact same principle at work inside the jaw.
By placing implants at very specific angles, including those pterygoid implants in the back, you create that same truss system. It distributes all the chewing forces perfectly and creates a rock-solid foundation for a full set of teeth.
Okay, so the engineering is amazing for sure, but what does it all actually mean for the person sitting in that dental chair? The person who was told there were just no good options left?
It means this. Clinical studies are reporting a success rate between 95 and 99%. Just let that sink in for a second. For a procedure that solves cases that were once considered impossible, that number is absolutely staggering. It means predictability. It means peace of mind.
So here's the bottom line for the patient. You get to completely avoid those huge grafting surgeries. You slash the treatment time from over a year down to just a few weeks. You get fixed permanent teeth, not something you have to take out every night. And the research shows it has very few complications and patients are overwhelmingly happy with it. It is, quite simply, a lifeline.
So let's bring it all home. Let's see what all this incredible science and brilliant engineering actually looks like in the real world, for a real person.
This is the ultimate outcome. All the complex anatomy, the advanced engineering, the surgical skill, it all comes down to this right here. A healthy, confident smile, and a happy person whose life has been completely changed for the better.
And this isn't just some theory. Here's a real case from the research. A 58-year-old woman comes in, she's got a broken bridge and wants a fix that's as minimally invasive as it can be. She goes with this approach, and just 3 weeks after her surgery, she walks out with a final, permanent, screw-retained bridge. It's just incredible.
So it really leaves you with a powerful thought, doesn't it? By completely rethinking the problem, by bypassing the weak spot instead of rebuilding it, and borrowing a timeless idea from structural engineering, an impossible situation becomes a 3-week solution. It just makes you wonder, what other impossible medical challenges are we going to solve next just by looking for an anchor in an unexpected place?